Hello and good morning, everyone. Thank you all for tuning in this afternoon. My name is Ryan Voyles, owner and editor of Health News Illinois. We have a fantastic panel joining us today to look at some of the ways that Illinois is, and everyone here is helping to address children's behavioral health. I want to thank so much to our esteemed speakers for sharing some of their valuable time with us today. I'm thrilled to introduce Matt Wolf, the Plan President of Molina Healthcare of Illinois, Dana Weiner, the Chief Behavioral Officer for the State of Illinois, Dr. Mashana Smith, the Associate Director of School Mental Health at Lurie Children's Center for Childhood Resilience, and Dr. Shubhrajan Wadyal, the Medical Director of Alexian Brothers Behavioral Health Group Practice, should be joining us momentarily. Before we get started, I want to give a big thanks to our generous sponsors of the Health News Illinois virtual event who make these events possible. So huge thank you today to Molina Healthcare and United Healthcare. Health News Illinois, is an online, nonpartisan news service. In addition to hosting events like this, we also publish a daily email newsletter. If you are not yet a subscriber, I encourage you to sign up for a free trial. You can sign up on our website at healthnewsillinois.com. One last note, slots are still available to sponsor our 2026 virtual and in-person event series. If interested, please reach out at rvoyles@healthnewsillinois.com for more information. And with that, I will jump right into the discussion. And Matt, I want to start with you on this one, and I'll ask each of our panelists this as well. But can you just tell us a little bit about some of the steps that Molina Healthcare is taking to address children's behavioral health?
Yeah, thanks, Ryan. And first, thanks for organizing the panel with such a esteemed group here today. I really appreciate it and appreciate everything Health News has done in promoting the work that is being done in the healthcare community. At Molina Healthcare, we know we cannot do the work alone on our end. We had to work together with provider partners. We work with McKinsey. We provided grants to them to be able to hire some additional staff. There's staffing shortages all across the state of Illinois. Our integrated care managers are consistently working to improve follow-up after hospitalization metrics and ensuring individuals are getting into their preventative care. So there's a lot of work that's being done on our end, but it's an overall partnership and collaborative effort on our end. Because we know it just can't be done by a managed care organization alone.
Fantastic, thank you. Dr. Smith, I want to go to you on that. Can you just tell us a little bit more about some of the things that Lurie Children's Center for Childhood Resilience are doing in this effort to address children's behavioral health?
Sure, absolutely. Happy to. So the Center for Childhood Resilience has actually been building on the capacity of adults to support the mental health and well-being of our children for over 20 years now. But rather than focus only on children receiving mental health services within our hospital's clinic, we aim to provide training and to provide resources to adults who are in the spaces where children live and learn and play. So this includes parents, it includes educators, park personnel, even Girl Scout troop leaders, but folks who have countless opportunities to improve the mental health and resilience of children. Currently, our largest project is actually in partnership with the Illinois State Board of Ed, ISBE, and this project, Resilient Supportive Schools Illinois, we call it RSSI, provides free, and it is optional, but free support to schools to help them really assess and improve their policies and practices in 4 areas. And those 4 areas are mental health, social and emotional learning, trauma responsiveness, and cultural responsiveness. And it allows schools to do it through a data-informed approach, and it also allows schools to create tailored specific action plans that they can identify those areas of resilience that are most relevant to their particular school community. So we've been doing that in partnership with ISBE for the past 4 years, and it's our biggest bucket of work in this space. But that's a little bit about what we're up to and what we believe in our mission overall.
Fantastic and great. And we now have Dr. Wadyal joining us today. Welcome. Can you hear me okay? Oh, you're still muted right now.
I apologize. I was having technical difficulties. Yes, I am here. Thank you so much.
Fantastic. Great. Well, I'll just throw this right to you, and I'm asking each of our panelists this, but can you just tell us a few of the things that you and the Ascension, Illinois are doing in this space of children's behavioral health and some of the initiatives that you're undertaking?
Well, for the last 10 years or so, I've been the medical director of our inpatient child and adolescent unit. So that is my subspecialty. I also work with children who are on the autism spectrum and run our group practice. So this is something I'm intimately aware of. In terms of initiatives, I think our main goal right now is trying to provide care to, what could arguably say the most underserved folks in our state. And, I tell people when people ask what my job is like being an inpatient psychiatrist, I say it's my job to call parents on the worst day of their life. And, the hope is that the subsequent days will not remain that way. But I think our main goal right now is trying to provide as much access to care to all of the members of the state, and especially in my case, the pediatric space.
Fantastic. Last, certainly not least, Dr. Weiner, can you just hit on some of the major highlights from the work being done by the Office of for Children's Behavioral Health Transformation?
Sure, and good to be with you today. So I've been serving since 2022 in the Office of Governor Pritzker as the Chief Officer for Children's Behavioral Health Transformation. And in that role, I've been asked to work across the 6 child serving agencies in our state. So you already heard about the Illinois State Board of Education. And I also work with DCFS, DHS, Illinois Department of Public Health, Healthcare and Family Services, which is the state Medicaid agency, and the Department of Juvenile Justice on improving and streamlining access to behavioral health resources for families, on adjusting capacity so that we have enough of the things that young people need, and on strategies to get upstream of problems so that we can intervene earlier. And then we have also 2 more systemic goals around improving the transparency of relationships between the state and the private providers that deliver many of the services to kids, and improving our agility as a state, that is our ability to pivot when we see that the needs of the population are changing. That's kind of a high-level summary of what we're doing.
No worries, and we'll definitely be diving into a lot of some of those sections later on, so we'll put a pin on that. But Matt, I want to go back over to you. Children's behavioral health has really become a larger policy focus for state lawmakers and the Pritzker administration in recent years. And I was just wondering, how has this increased focus and awareness affected the work being done by, Molina?
That's a great question. So as the administration continues to prioritize children's behavioral health, Molina remains dedicated to increasing access to care any way we can. Deeply committed to the whole person health and investing in programs and partnerships that address children's physical and behavioral health, improving both their physical and mental well-being. Across the country, behavioral health challenges are increasing among children. Recent data showing that as recent as 2009, 26% of high school schoolers had depressive symptoms. Now almost 40% experience depressive symptoms as of 2023. It's just more than double, or about doubling since in a short period of time. So more specifically in Illinois, 2025 report from Ann and Robert H. Lurie's Children's Hospital, the number of Illinois children who had 1 or more worsening mental symptoms has been running between 49% and 54% from 2022 through 2024. So to address this, Molina has many partnerships that address behavioral health care, some of which focus acutely on children's behavioral health. Our ongoing partnerships with ADAS and Kinsley, which I mentioned previously, include children's behavioral health program.
Recording in progress.
Post-crisis care for Medicaid individuals under the age of 21. Through this partnership, we work to reduce readmission and barriers to care by following up after crisis screening calls and connecting children to designated community-based clinicians who provide home and community-based therapy to our members. So that's just one example. We also have a partnership with Collaborative Bridges that takes a very similar approach in a different community for individuals who are addressing social needs that have an impact on behavioral health. So those are just a couple examples. Recently, we did announce a $1.6 million investment in Illinois to support initiatives that will help improve access to care in areas that are really that are underprivileged or underserved and do not have as much access. So anything that we could do to help support individuals and provide more doctors and behavioral health therapists is a key initiative that we're trying to provide and support the administration as best we can.
Fantastic. Thank you, Matt. Dr. Smith, I want to go to you on that. Just as we see this increased focus on this issue here in Illinois, just how has that affected your work?
Yeah, thanks for the question. First, I think we probably all share like the utmost respect for the work that our governor's done on shining a spotlight on the importance of children's mental health. I'll say here at the center, we've been focusing, like I said, on this for the past 20 years, and we've seen a lot of stigma around mental health, particularly among some of our most vulnerable populations, right? And while it's hard to see any silver linings that come out of COVID, I would say the one silver lining that we've seen is that, whether people experience individual stressors or collective stressors, that it changed folks' beliefs that their community was immune to the experience of trauma or mental health problems. No one believes that anymore. Everyone accepts that it's a part of all of our communities, whether it's an urban community, a suburban community, a rural community. But couple that level of awareness with all of the governor's spotlight on mental health and the ways in which he's making this very visible, we see that we're now propelled forward and in a space where we're leading. So to answer the question about like how it's affected the work that we're doing, it's made us increasingly excited and eager to be a part of the work, to be engaged and to support it in any way that we can, particularly around the school-based components and being able to get schools the resources that they need in order to really address the needs, the mental health needs that students have. And particularly, I know we'll probably talk about this later, but particularly in the universal mental health screening space, wanting to be sure that we can be a partner and an ally in this work, supporting ISB, helping to ensure that schools have, community partners who can augment this work and, playing a role in the convening of those stakeholders and hearing from everyone around that. And then also building out toolkits and providing supports, resources to support schools in being ready for some of the new changes that are coming down the pipeline. So I think that's some of the ways in which all of the governor's efforts, the blueprint, et cetera, is beginning to affect our work and how we can contribute to this effort.
Fantastic. Thank you so much. Dr. Wadyal, just kind of from your perspective, how has this, increased focus, increased awareness of children's mental health affected some of the work that you've been doing?
Well, I'd reflect upon what Dr. Smith just said by indicating I did my training in Louisiana, so I get to see the market disparity between different states, and I would say that Illinois should be proud of itself having the opportunity to serve people in a multitude of other states in my years of work. It is clear the reason why I moved here is that the destigmatization and access to care parallels or exceeds any other state that I've had the opportunity to work in. So I would commend the governor on that fantastic work and the entire administration on behalf of the clinician. Thank you. Now, that being said, we always have room for improvement. And, the best way I could put this is a typical day for me starts. I'm at the hospital by 7 a.m. I see patients back to back to back to back in inpatient, outpatient, PHP, IOP, residential formats. Get home around 7 o'clock with a breakneck pace and then do notes until midnight. I was told psychiatry was a lifestyle specialty. I don't think that's come to fruition. And the reason why I do it is there's always one more patient. There's always one more family in crisis. And there is a shortage of people who are willing to take on those who have less and care for them, because sometimes the financial reimbursement or all the other political factors make it challenging for them to do so. I've been blessed to work for an organization that is faith-based and therefore tries to extend that courtesy to all of us.
Fantastic. Thank you so much. Dr. Weiner, I want to go to you and for a few questions here and hit on some of the big projects that you and the state and the administration have been working on for the past few years. Firstly, the state released a blueprint in 2023 to outline a pathway to increase behavioral health for children. About 2.5 years later now, I was just curious because how far along have we come towards addressing the recommendations from that report?
So I'm proud of the progress that we've made, and I have been doing this work in some form or fashion for the last 25 years. I've never seen such convergence of support, both from the executive and legislative branch, but also interagency collaboration across the child and family serving agencies. So I'm happy to say that we've accomplished a number of the things laid out in the blueprint entirely, and then other things we've made good progress. And so I'll talk a little bit about that. So probably the most visible accomplishment is Beacon, which is the state's centralized care portal for families to use to access the behavioral health services that are available through the state and also those that are local to their neighborhood and community. And Beacon is serving hundreds of families every day. So far, we've had 26,000 distinct visitors to Beacon, and on any given day, it might be 150 or it might be a few hundred that come for information. And then a handful of those request help from one of the team members at DHS. And what that looks like is a resource coordinator reaches out and contacts that family. Beacon provides assistance to families that wasn't there before. It gives them all the information about state-funded services in one place, gives them the option to request a call from a person who knows about those services. And it also gives them the option to create an account where they can upload documents like the hospital psychiatric evaluation or the IEP if the child has an individualized education plan, and put all of those things in one place. What it does that's a little bit less visible is it overcomes the legal and technological barriers to collaboration across the agencies, because families give consent when they open an account for those 6 agencies I mentioned to talk to each other to expedite services and treatment for the young person who needs care. That's a very different approach to sharing information across agencies. It puts the power in the hands of each family to say, yes, my information will be shared with these places in order to do this task. And it's been working really well. We've gotten consent from every family that's asked for help, and it does let us work together faster. And some of the downstream consequences of that are there are fewer kids in the hospital beyond medical necessity because they're not waiting quite as long for services. It doesn't take us as long to connect kids to the state funding pathways that can get them a residential treatment bed, for instance. So that's probably the most pronounced and visible accomplishment. There are a lot of other things we've accomplished. Some of them behind the scenes. We've created a repository of all the residential treatment beds in the state, and providers who do business with the state are required to report in daily on their available beds. We did not have a way before 2022 to know how many beds were available on a given day, because each of those 6 state agencies I met, 5 of those 6 state agencies purchased beds separately. And so no one had a single source of information about the capacity that we had. We've also stood up some pilots of new types of services, and in partnership with private philanthropy, we're working on rebuilding community networks. So we have a lot of things going on, and also very visible. You mentioned the school screening legislation, and that has really been the next step in a very slow and methodical, intentional process to build the foundation. And we've made a lot of good progress on building that foundation. So we'll be ready to do that when it goes into effect in 2 more years.
Fantastic. And Dr. Weiner, that led right into my next question I had for you, but obviously lawmakers did, pass that this spring. Pritzker has signed into law that there will be universal health screenings in public schools by the 2027-2028 school year. And I wonder if you can just tell us a little bit more about what this implementation is going to look like, and then also maybe talk about how you think this is going to be help in the larger children's behavioral health, work.
Sure. I'll tell you what I can. I can certainly talk a lot about what led us to this decision. Early on, it was clear that we didn't have a comprehensive understanding of how many kids need help. So many people were saying, we don't have enough services, we don't have enough psychiatrists, we don't have enough community behavioral health. But in answer to the question, well, how many people need help? We only had estimates, and we had estimates from the CDC and other nationwide surveys from which we extrapolate. And we adjusted those based on exposure to community violence and poverty and other stressors. But that's as close as we could get to understanding how many kids need help. So it was clear that we needed to do a better job of understanding at a more local level what the need was. But I think the other thing we're seeing is on the more intensive end of the service continuum, where Dr. Wadyal and others are working, we sometimes see kids in the emergency room and in the hospital who had not received any sort of services earlier on or any sort of assessment. And what we heard from those families and from those kids is that they wish someone had asked. They wish that someone had identified these problems when they were more treatable and less acute and less potentially fatal. So that was some of the motivation. But what we did in the very first year we started implementing in 2023, we worked with Illinois State Board of Education to conduct a landscape scan to understand what are schools doing? Are any schools conducting universal mental health screening? And indeed, we learned that about a third of them were screening every child, and 2/3 were doing some form of screening. So that also made us think that we needed to provide support and some consistent best practice approaches to doing this screening, because right now all the school districts are doing something different. So I'm just laying out kind of how we got here. In the next year, what we did is we looked deeply at those school districts that are conducting screening. We said, what makes this work? What are the ingredients for a successful implementation of this? And we heard about 5 different things. We heard that the school culture has to be conducive. There have to be policies in place. There need to be tools and technology. There need to be partnerships in the community, like what Mashana talked about. And there needs to be an effective way to communicate with families and with each other to get services to kids who need them. So we took all of those ingredients. We went back to all the school districts, surveyed them all to figure out who's ready to do this and how ready are they. That's how we got to this plan for universal screening being offered by the 27-28 school year, because then we had a clear view of what everyone's doing and how ready they are. So in answer to the first part of your question, how will this look? ISB is still working on the specific policy guidance, and it is due to be delivered in the fall of 2026. We are also working on some of the associated pieces that are necessary. So we don't want to implement universal screening until we can put in everyone's hands a resource referral tool that will allow anyone in that school building to make a referral or to provide resource information. That's really important. And we're working with HFS on that so that we can leverage Medicaid funds to build it. We also know that we need strong community networks. 15, 20 years ago, there were local area networks that were attended by school partners and community mental health partners. And now it experienced some divestment at the state level over the last 20 years. And so those networks are happening inconsistently. Now we're trying to rebuild them with the help of some creative partnerships and collaborations. So that's kind of where things stand now. We're also going to be leveraging RSSI, which Dr. Smith talked about, as a platform and a strategy that can help schools understand what they need and access additional resources to build themselves up on those 5 dimensions that I talked about. So we're working really hard in collaboration with ISB and communities.
Fantastic. Great, Dr. Weiner. I want to come back to this conversation, but I understand Matt is going to need to jump off soon. So, Matt, I want to give you one last question here before you go. And, you talked earlier about some of the work that Molina has been doing, working with community organizations. And I wonder if you could just talk a little bit about some of the importance of these collaborations, between public-private groups and how that can help address this issue.
Yeah, thanks, Ryan, and apologies for the early dismissal, but I do have a kid that needs to be picked up from school on my end, and I'm the only one to be able to do it at the moment. But these partnerships are everything. being able to work together, collaborate amongst organizations, providers, payers, policymakers, just doing what's right for the individuals and being able to support them any way we can. There's no one organization that can do everything. There's no one organization that is at the forefront to be able to provide all the support. So finding ways to be able to pick up the slack or pick up and support as two different organizations who work on different ends of the spectrum. That's ultimately the best way to be able to support and provide the need that everybody can. So we know as a managed care organization that, we don't have the doctors within our system. We have the care managers. So being able to connect individuals to transportation, being able to connect care individuals to receive waiver services that the state's been capable of being able to provide and support and expand. So just finding those types of solutions and working together with the different types of organizations is key to be able to support these ongoing services going forward.
Fantastic. And Matt, I'll leave you with one more here. I want to see if you can give us a little preview here of, what's next for Molina on this front. What do you see as some of the next initiatives that you'll be undertaking here?
Yeah, we know the landscape's changing immensely. We know the state's going to be changing a lot of the requirements in the future, potentially changing a lot of the requirements in the future. Finding a good partnership with the state programs and just figuring out, how we could be able to support those that are in need through some of the key investments that we've been making here in the state. We did mention a $1.6 million investment that we're looking to make. And so just trying to continue to be able to support any way we can.
Fantastic, Matt. Thank you so much for joining us today, and good luck with picking up your kid. Have a good one. Dana, Dr. Weiner, I want to go back to you, on the conversation about mental health screenings in schools. We have seen some pushback to that initiative in, recent weeks, and that includes an op-ed that ran this week from Health Secretary Robert Kennedy Jr. and Education Secretary Linda McMahon, who said Illinois' effort is misguided and it turns students into patients, and that meaningful work should be focused more on, increasing physical activity and reduce online screen time. I was just wondering if you had any thoughts or response to those concerns about this effort.
Yes, I have so many thoughts. Let me start by saying I wholeheartedly agree that exercise is good and nutrition is good and getting off screens is good. I think it's important that we have a way to identify which kids need a little extra support in getting to some of those like positive contributors and determinants of health. I also have found, because I've been, monitoring the news on this, and anytime we propose or begin to implement a big innovation, it can be uncomfortable for people. It's hard for people to think about how we get from where we are today to where we need to be without really having good understanding of all the steps we've been taking in between. So, part of the problem is that some of the responses have not been informed about either what the law says or the types of screening tools that we are proposing to use. For example, screening tools are meant to identify kids that may be struggling. They consist of a series of innocuous questions, statements that you might agree or disagree with, like I feel safe in school or I worry and I don't know why. These are not tools that are assessment tools. So screening tools identify kids who might need an assessment. An assessment tool is what you would need to do a more in-depth evaluation that would arrive at a diagnosis. Screening tools don't produce diagnoses. They certainly don't direct kids to any particular treatment. They certainly don't direct kids to any particular medication or strategy. They're meant to identify people who may need help. And what we heard from many parents and young people were that they wish someone had asked them, both because it would destigmatize the process of seeking help, because many kids feel embarrassed and or maybe even their parents are uncomfortable with identifying problems or asking for help. And they just didn't know where to turn. So, given what we've heard as an outcry from the community of people who need help, in addition to what we see as an opportunity to identify people earlier so that they don't end up with acute and really dangerous types of mental health crises. We're putting something in place that is a relatively innocuous, benign intervention that will let us see and offer some assistance. The other thing I want to just reiterate that I said earlier is that many Illinois school districts are already doing some form of screening. This gives us an opportunity to ensure that what they are doing is happening in a way that is consistent with best practices, that is supported by policies that have been developed by the state, and also that uses technology that can make things more efficient and easier to deliver.
Fantastic. Thank you so much. Dr. Smith, I want to go to you on this topic of the school mental health screenings, and just kind of what are your thoughts on, these screenings, and how do you think this will impact children's behavioral health in Illinois?
Well, thank you for the question. I am certainly a fan and believe in the importance of universal mental health screening. I think we've been talking about the importance of upstream interventions. And, historically, we have done other screenings in our schools, whether it be a hearing screening or a vision screening. These are screenings that help with early identification and hence early intervention. I think universal mental health screening offers us the same possibility. And I know there has been some pushback, and I, by all means, completely respect dissenting opinions and believe that parents should absolutely be involved in decision making in this area. And we should respect parents' rights to choose, right? But also just knowing that, to the point that Dr. Weiner just made, that there are many parents on the ground. We're hearing from a substantial number of parents who want to be able to regularly monitor their children's mental health. So I think some of the language and some of the pushback that we're hearing, some of our arguments simply don't reflect what we're hearing from parents on the ground, what we're hearing from students. In fact, students, older students, that is, adolescents, were instrumental in pushing through and delivering this legislation that we have. So we aren't doing this alone. I think we're listening to the community, we're listening to youth, we're listening to parents, we're listening to educators, and I also think we're listening to the data. Suicide now is the third leading cause of death for Illinois young people. In 2022 alone, we had 83 children who died by suicide. This is more than one every 4 days. And so I think this is an opportunity for us to truly practice a public health model within our school, have early identification and early intervention, and begin to really intervene and save and raise the quality of life for our children. So, I'm an advocate and do believe in the importance and the value of universal mental health screening in our schools. And also, Ryan, if I can just add one thing, which is that universal means all districts must offer this screening. It doesn't mean all students must be screened. So anyone who's still uncomfortable with this idea, whether it be a child or their parents, they don't have to do it.
Fantastic. Dr. Wadyal, just kind of what are your thoughts on this? How do you think this will the effect this will have kind of in this larger conversation about children's mental health?
Well, when it comes to screenings in particular, they save lives. It's that simple. I don't know the data. I'm not a high-level guy. I'm a simple psychiatrist who sees people on the ground. Mm-hmm. And my children are in Illinois public schools, and I fully love that they're being screened because I can miss something. I'm not perfect. So every day, we know when the screeners go out in certain districts, there's a multitude of kids come in. And it's nice to say, oh, I don't want them labeled as a patient. You don't sit there at 7 in the morning and look at an 11-year-old with cuts all over their body, or someone who's malnourished because they've been starving themselves. You don't talk to the mother who just had a child overdose that I'm accepting from the ICU. And this is over and over and over again, 7 days a week. This is my life. These are not statistics. These are our children. And I'm not a psychologist. I'm not a therapist. The letters after my name are MD. I treat medical illnesses. Mm-hmm. And the stigmatization of them is something I'm against. And when it comes to the secretary, I'll respectfully decline to give you my opinion about his statements.
All right. Well, thank you so much for that. Dr. Weiner, I want to go over to you, and we'll switch gears a little bit. And I want to go to something that you touched a little bit earlier, and I asked Matt before he jumped off. But, this idea of the collaboration between public and private groups, and what that can mean as far as, this greater effort to address children's behavioral health. I was wondering if you could just talk a little bit about some of the things that Illinois is doing here, as, the state partners, and kind of what some of that work is going to look like in this effort.
Yeah, so Illinois is a state that depends heavily on the community of private providers to deliver most of the services that children and families receive. And in our work in the Transformation Initiative, we really have made a concerted effort to be collaborative with the provider community, to engage them in all of the decisions around new things that we're building, new processes that we're putting in place, and really have valued their perspective on to learn, like we are from Dr. Wadyal and others, on what they're seeing on the ground and what we need to do to make these systems and processes better. I can give you a few concrete examples of some of those collaborations. We work collaboratively with the Illinois Children's Healthcare Foundation. I mentioned we're trying to rebuild community networks, and the Illinois Children's Healthcare Foundation has been instrumental in helping to provide funding and support for family-run organizations that are going to serve as partners in anchoring this new network of networks that we're building across the state. We also have been standing up, and I mentioned some of this work has involved standing up pilot programs. We have a new pilot with the Illinois Department of Human Services that is designed to provide in-home behavioral health aids to the families of kids on the autism spectrum. So these are kids who might have a one-on-one aid in the classroom setting, but when they come home from school at the end of the day, they still need that level of attention, and their parents oftentimes cannot provide it. And these are kids that we see in a hospital setting where parents sometimes don't even feel like they can bring kids home when they're ready for discharge because they can't handle that amount of supervision and attention that that young person needs. So we saw in a few other states this program to deliver in-home behavioral health aids, and we have now have that stood up in Illinois with the help of two private providers who are willing to go on this journey with us and build a brand new program here. And they are Spring Health and Trinity. And we're covering about a dozen counties in the state in this pilot round of delivering these services. And that's just another example of, how we're partnering. So I think we're partnering both on making plans, on implementing plans, and on supporting and resourcing some of those plans.
Fantastic. Dr. Smith, I want to go to you on this question. Just kind of, what do you see as the role of these collaborations to address the issue of children's behavioral health?
Ryan, I think they're critical. And perhaps never has there been a time where they're going to have to be more critical. But we are an example of a public-private collaboration. As I stated, our work at Illinois Children's Hospital with the Center for Childhood Resilience is in partnership with the work that ISBE is doing. Our current program provides free and voluntary support to schools, but we are doing this in partnership with ISBE, with the social and emotional learning hubs that are across the area to really ensure that we're targeting all schools, making it accessible to all schools. And we've done a good job for the past couple of years. We were fortunate to scale this work with pandemic relief dollars, but as we all know, those dollars have sunsetted. And while we're in 1,200 schools across the state, the reality is that that's only 25% of schools. And in order to scale to benefit all of our students, we are going to need funding. And it is going to have to come from both public and private funds. We're fortunate to partner, Dr. Weiner named a couple of funders, and we're fortunate to partner with a couple of private foundations who believe in this work and wanted to live on despite the sunsetting of those ESSER dollars, those pandemic relief dollars. But with the cuts to federal funding, I think this is a time where we're all going to need each other. Blended funding and service provision is going to have to be the way to go.
Definitely. And Dr. Smith, you kind of touched on something I was going to get to later, but let's just get to it right now. It just, we had some submitted questions, just kind of that idea of just how do we think that changes at the federal level are going to be affecting this work? Do we have an idea yet of what that impact might be, or any sort of forecasting of what that could look like?
Yeah, we've already seen significant cuts to from the Department of Education to grants that benefit children and benefit children's mental health, whether it's the removal or decrease in funds in out-of-school time programming that supports the mental health, well-being, and resilience of youth. So I don't know if we have a dollar figure. I can't speak to that specifically, but we know that absolutely education and mental health are going to be impacted by the federal cuts, and, probably hugely. And while that is a reality that we're experiencing, when we talk about the potential benefits and gains of the systems that we're putting in place that Dana has spoken to about the programming and like the universal mental health, all of the systems, the ecosystem that we're talking about putting in place, I think despite what's happening on the federal landscape and funding environment, that we can't afford to underinvest in these critical pieces that we're talking about. And so it is going to be critical for us to be working together to see what our state government is able to support, as well as what our private funding sources able and willing to support during this time to really ensure that we continue to make the strides that we've made. If you look at the data from Mental Health America, they rank states every year on how we're doing in terms of the number of youth that have severe mental health problems and the number of youth who are receiving help. And for the past 4 years, Illinois has consistently improved its ranking. We're currently number 4 in the country when it comes to serving youth. So we want to continue making these gains, and I think the only way we're going to do it is through these public-private collaborations that you're inquiring about.
Wonderful, thanks. Dr. Wadyal, obviously a couple different topics that just got broached, but I want to go to you on that public-private partnership, just kind of, especially, some of the work that you and Ascension are doing as far as, and how that can help.
Well, it's become a necessity. I serve on the board of the Ascension Foundation, which, tries to bridge the gap for people who don't have access to care for a multitude of reasons. I also serve in our Physicians Council, where our physicians have donated over $1 million to care for patients. And the truth is, these kind of initiatives exist. I'm not political, so I'll be honest. These cuts, those who made them have blood on their hands. It's that simple. People are going to die. Children are going to die. And as a result, I'm not in a place, where I can change the political landscape. I am so, I commend Dr. Weiner and Dr. Smith's work, because I don't know if I have the tact to do it. The truth is, we have to do whatever we can. It's our instinct as humans to keep our children alive. And I'm so glad I live in a state where that's something we view as a collective. And if we have to use private funds, we have to use public funds, whatever we have to do, please, for the love of God, give us the opportunity to keep our kids alive.
Absolutely. And Dr. Wadyal, I want to stay with you, and I think we've kind of already touched on it a little bit, but as we look ahead, what do you think are some of the major challenges that remain in this effort to improve children's mental health?
Well, I think one of the biggest challenges we've had is in the last few years, we've seen the re-stigmatization of mental illness due to political discourse in this country. And as a result, often, to say that we're labeling children as patients, we're all patients in some extent. And to say we're labeling this and we're doing that and we're mocking those of us who serve, the most vulnerable children that we have, it's going to make our job more difficult. And I'm glad to partner with, folks like Dr. Smith and Dr. Weiner and your organization, because we're going to have to shore up every single resource we can. I don't have a good answer, and I don't have the ability to change the way the politics at the federal level of this nation run. What I do have the chance to do is fight as hard as I can for each subsequent kid that's in front of me, and there's going to be more of them. We're going towards an economic downturn. People are struggling. And having the socioeconomic factors out there that could lead to worsening symptomatology, I don't see it changing in the near future. That being said, I'm a simple first-generation American who maybe shouldn't be allowed in the country according to the current administration.
Dr. Wadyal, thank you for that. Dr. Weiner, I want to go to you just kind of on this topic of, what do you see as some of the bigger challenges that remain in this effort?
So I'm interested in the progress we've made. I think some of the things that are a little more difficult to address have to do with the workforce issues that we're confronting. we've tried to take some also to apply some creativity and leverage some of the untapped resources that we have in roles that we're calling like mental health extenders, or some people talk about them as paraprofessionals, but people who are returning to the workforce or who might serve some of the more supportive roles. But it can't get us to where we need to go in terms of also the more like skilled, highly trained roles in our workforce that we really need to continue to focus on incentivizing and rebuilding. I think also some of the fiscal issues, and you asked Dr. Smith, to comment on concern about federal policy changes, contemplating some of the cuts to Medicaid, I think, can potentially threaten our ability to implement some of the big changes that are underway. I also just want to say that on the note of both the federal level and some of the biggest challenges, I think the thing I'm the most worried about is the erosion of commitment to a public health approach. I think over the last century, public health has brought us some of the greatest triumphs and extended the lifespan and the quality of life of people. And the idea that we would turn away from some of those huge public health accomplishments, like screening, like preventive care, is really the most alarming message that I hear, because then we're really taking us back, and having to start with less information and less initiative and kind of a foundation of a preventive public health focus. So.
Definitely. And Dr. Weiner, I want to stay with you. Obviously, we talked about some of the concern at the federal level, but we'll say in Illinois, the General Assembly has been very supportive of this work in the past. And I'm just curious, what do you think is next on this front? What more do you think policymakers can do to address children's behavioral health?
So as I mentioned, we are at a unique moment in history here in Illinois because we have a convergence of really strong support, not only from the governor's office and from his team, but also from a core of legislators, some of whom I think are on this call, partners in Senator Feigenholz and Senator Fine and Representative LaPointe, and many others who've really who share our concern and commitment to addressing children's behavioral health issues. So, we'll continue to work together with them to identify opportunities to realign things so that we remove the barriers to working together as a state and allowing families to access services. We have a few more ideas about things that we could make possible through legislative change. We will continue to rely on those legislative partners, both as thought partners and to get some of this work, to get it closer to full implementation.
Thank you so much. Dr. Smith, I want to take that question over to you. Just what do you think lawmakers and policymakers can be doing on this front?
Good question. I just want to echo the thanks that Dana just expressed. Just extremely thankful for what our legislators have already done in terms of passing what is oftentimes bipartisan legislation and making some real historical steps. But in terms of other things that they could do, I think it's important that we adequately fund and resource many of the pieces of legislation and recommendations that are coming out for our state. I know over the years, we've talked to many legislators about the impact that our particular work, Resilient Supportive Schools Illinois, RSSI, has had in its focus on mental health, and the positive impacts that it's had on schools and on students. Students who are participating in schools that have RSSI are less likely to be chronically absent. They are less likely to have out-of-school suspensions, and they're more likely to retain their teachers year after year. And I can share this evaluation data with legislators, but I also encourage policymakers to go into their districts, visit the schools, talk with principals, talk to teachers, and learn about the difference that programs like RSSI are having in their school building, and that are having for, to hear this for themselves, right? As opposed to only hearing it from me. I think it's powerful and allows our legislators to better understand the need for additional resources, and they will be necessary even in this very tight financial situation and times that we find ourselves. So that is one recommendation that I would make for legislators to really hear about the meaningfulness and significance and impact that this work is having on the ground. and just let that inform some of the decision making as we enter into budget season again.
Fantastic. Great. Dr. Wadyal, I want to go to you on that. Just kind of what are some of the things that you hope to see, policymakers do on this front to help the work that you,
It would be my hope that they would see that the return on investment, you're talking about financial, challenges and budgets and things like that. There is no greater return on investment on these dollars invested in our children. This is our future. This is every time you're putting a dollar forward, I can't give you an exact ROI, but this is mission critical. It's as important as, financing our roads, as making sure we have fair elections, as making sure we have good education. Because if we have all those interventions and we lose these children, it's all for naught. The thing that I would say is most impactful, people say to me, oh, you get to help so many kids. You see so many of them you forget. The few that I've lost over the years, their voices haunt me. And those dollars may have saved them. Mm-hmm. So if there are legislators here listening, I implore you, please, this is not political. We just want to help these kids. Please help us give us the opportunity to do so. I'm begging you.
Absolutely. Thank you so much for that. We're getting close to out of time, so I want to go to each of our panelists with just one more question. Just kind of give us a little preview, looking ahead. Just kind of what are some of the things that you and your organizations are going to be doing as far as addressing children's behavioral health? And Dana or Dr. Weiner, I want to go to you on that first. Just kind of what do you see as next for the behavioral health initiative?
So we're going to, as I mentioned, continue to work toward getting the school districts ready to be able to offer screenings. We also are really focused on getting the technological system that I just briefly described. It's kind of a companion to Beacon. So Beacon is a centralized care portal. The resource referral tool that we're looking to procure with the help of HFS is meant to be on everybody's smartphone, almost like the open table of outpatient behavioral health, so that everyone has the ability to see what's available and either make an appointment or make a referral for a young person. We think that is really an essential piece of infrastructure if we are going, because as Dr. Wadyal mentioned, screening it illuminates the need that's already there, but it shines a light on it, and then people are open to doing something. We want to make sure that we can make a connection for them. So we're working on building the technology. We're also always refining our ability to measure the effects of our efforts. So we're looking at things like, are fewer kids being hospitalized? Are they spending less time in the hospital? Are fewer kids coming into state custody for the purpose of getting a psychiatric intervention? Because that was happening at a higher rate than we'd like. We really don't want that to happen at all. So keeping an eye on those and making the outcomes of this and the outputs and the outcomes of this work more visible to people, to kind of make the case for what we're all talking about, which is continuing to invest, because these efforts do pay off. We're already seeing that those indicators are moving in the right direction, and we want to keep driving so that we can get to a place where nobody is in the hospital if they could have had their problems addressed with a less intensive, less intrusive intervention.
Thank you so much, Dr. Weiner. Dr. Smith, I want to go to you on that. Just kind of what's next for the Lurie Children's Center for Childhood Resilience in this effort?
Well, I think we're going to continue to build upon the significant progress that's been made in promoting resilience in our schools. As Dana was just sharing, we have universal mental health screening coming, and we know that that's going to help schools identify students who are facing challenges. There is the Children's Adversity Index, and that's going to help schools to understand the context in which students' problems and mental health challenges are occurring. And then there's RSSI and there's Beacon to offer schools the tools and the systems, the partnerships, and the providers that are needed in order to respond effectively. So over the next year or so, we very much so plan to be a part of this amazing ecosystem that's being developed, that's going to be beneficial to students, to help to continue to develop tools and resources to really ease the implementation of some of the new efforts, make things easily accessible, and help our schools to be able to implement not only effectively but responsibly. So I think that's what's on the radar for us, and I'm looking forward to what the next year and more can bring.
Thank you so much, Dr. Wadyal. I'll give you the last word on this. Just kind of what's next for you and Ascension in this effort.
Well, we're going to try to expand everything we can. We have specialized efforts for children on the autism spectrum, and they're very specialized and immense set of needs. We have the goal to expand as much outpatient care as we can, PHP care as we can, and inpatient care as we can in a changing healthcare and political dynamic. And there are a multitude of ways we're trying to do this. And, obviously there's a cost basis to it. There's challenges with reimbursement and challenges with access to care. And our hope is to navigate this with our leadership so that every single child that needs access to care will get it, and will get it with some alacrity, not with them waiting months while they suffer.
Absolutely. Well, thanks so much. It is 12:58. I'm going to let everyone out just a minute early, but I want to thank you all for joining us today for this very important conversation. Again, thank you, Dr. Mashana Smith, Dr. Dana Weiner, and Dr. Shubhrajan Wadyal. Sorry, I'm so sorry.
You can just call me Raj. It's easier.
Well, thank you so much, Raj. Thank you so much for joining us on a Friday afternoon, to discuss this. And thank you so much to all of our panelists who joined us, and all our attendees who joined us today. Really appreciate it. Thank you so much, everyone. Just a quick heads up, our next in-person event is on this Monday morning in Chicago, as we're talking about what's next for Medicaid. Limited tickets remain. So if you want to get some of those, you can find more information on healthnewsillinois.com. And with that, I wish you all a great rest of your day and a great weekend. Thank you so much, everyone.